Well, let's talk about cataracts. I'm Dr. Troy White, and let's discuss cataracts. So in one of my previous videos, we talked about the lens and how the lens loses its flexibility over time, and that's called presbyopia. And we need reading glasses or a progressive or specially made contact lens to help us to see up close. Well, there's another thing that happens in the lens as we get older, and that's called a cataract. And so cataract, instead of the lens just losing its flexibility, it actually begins to get a little cloudy. So think of a window or a shower door that starts to get fogged up. Or think of those windows that have lost their little vacuum seal and the moisture or the condensation gets in between the glass panels. And then you try to look outside and you can't see. So that actually happened in the house that our kids grew up in. You know, it started out, we bought the house, it was a little bit older house, and it's like, oh, look at that little condensation just in the corner of the window. Well, sure enough, year after year, that condensation just continued to progress across that window pane, where it got to where we couldn't even see the kids in the backyard. So that's not unsimilar to what a cataract does. A cataract is a clouding of the lens. So it used to be, you know, as we're young, that lens is crystal clear, like looking through a window pane. But over time, it gets more yellowed in the center. Sometimes on the outer edges of it, it gets more cloudy, kind of like that condensation. And so what happens is light doesn't get through to the retina as easily as it did before. And so symptoms of cataracts can be needing more light to read. It's like, oh, dim light, I just can't see. I got to turn on more light. I've got to walk over to the window and I've got to have more light to see better. And then night driving can be a whole lot worse with cataracts because you've got light coming in the retina, into the retina, but it's hitting that cataract and some of that light is scattering, some of that light is being absorbed, so you're not getting as much light that hits the retina. Now, with cataracts, it can happen so gradual over time that the patient doesn't even realize that it's happening. So it's very important to get annual eye exams. If you're over 40, one to check, you know, the health of the eyes and to check to see if you need reading glasses. But also to check the lens to make sure that cataracts aren't starting to form. So how slowly can they be advancing? Well, I've had patients come in thinking that over time that their vision was just getting worse and they needed to update their glasses. Well, it was actually the cataract that was causing their vision to get worse. Some patients will see early cataracts and they're not really having any symptoms, and we'll watch them for 2, 3, 4, sometimes 5, 6 years before the patient is ready. So what's nice about cataract surgery these days, 7 to 10 minute surgery, outpatient, no stitch, no shot cataract surgery. They numb the eye, they give you something in an IV to relax you. The surgery's over really before you even realize it. And they replace it with an implant lens that can correct your prescription. So if you've worn glasses all your life for distance, for nearsighted, they can put an implant in that corrects your distance vision. If you've been farsighted your whole life, it will actually help you see better distance and near. Now you'll still need reading glasses or reading power if you choose that option, but now they even have options to correct your astigmatism and to allow you to read and see in the distance. So cataract surgery is not as scary as it used to be. There's a lot of great treatments. And before the treatments, before you need cataract surgery, we can change your glasses prescription to make sure you're seeing your best when you drive at night, to make sure you're seeing your best when you need to read. So come in, make your eye appointment, let us make sure that you don't have cataracts. If you do, let us watch, let us monitor, and then we'll let you know through a conversation with you. We'll make a decision when it's best for you to go ahead and proceed with cataract surgery.